Well, hello, and welcome to our Module 2, Chapter 2, Foundations of the U.S. Healthcare Delivery. Continuing on our subject of nursing leadership, now we're moving into just healthcare leadership. And it's important to understand the foundations of how healthcare is delivered in the United States before we can understand how we can lead the healthcare delivery system. The other text that you are reading for this course is John Maxwell's 21 Characteristics of a Good Leader. And in this video that is in your Canvas Module 2, it's an interview with the author, John Maxwell. And in this video, he talks about communication. And it's a great video. So watch just like the first 10 minutes of it at least. It's an hour interview, but he says, if someone says, John, I can only master one skill to be a good leader, what would that skill be out of all the 21? And he said communication. Communication is where it's at. And it's all about thinking, like, get out of yourself, get out of your ego, and think about your audience and who you're communicating to. And I just think this is such an important skill. I agree with Maxwell. So if you can think about this week, really focusing on communication, and think about it not just with your patients, but think about it with your loved ones, with your roommates, with your partner, with your kids, with your parents, whatever that is. And practice, because it really is a hard skill and you get better at it the more you practice. So yeah, go ahead and watch that video. It's pretty good. So getting back to our Chapter 2, Foundations of the U.S. Healthcare Delivery, thinking about beliefs, values, and health, thinking about the promotion of health and prevention and how that benefits society. We know that social norms explain how we view illness and our expectations. We know that optimum health exists when a person is free of symptoms and they're not requiring any medical treatment. And the Society for Academic Medicine states a state of physical and mental well-being that facilitates the achievements of individual and societal goals is health. Again, I'd like to call your attention to the lack of nursing that is in this text. And we kept this text knowing we wanted to call that out because we we need to be included in the leadership discussions and texts, and it should not all be medicine, but nursing as well. Holistic health, nursing knows this well, treats the whole person. Marquette nurses are very good at this. Cura Personalis, incorporating alternative therapies, not just medical. And we know that holistic health also thinks about mental, societal, and spiritual aspects. And we do know that literature shows that religious and spiritual beliefs does impact overall well-being in a positive manner. We can't forget that when we're caring for our patients. Whoops. Indicators of health, again, are self-reported health status, our life expectancy, morbidity, mental well-being, social functioning, functional limitations, disabilities, and spiritual well-being. Illness is identified by a person's perception and evaluation of how they are feeling. Disease is based on a professional evaluation. It is possible to have a disease without feeling ill or feel ill without having a disease. Most people that have diabetes and prediabetes don't know that they have it. Quality of life, we know, is a term that is used in a few different ways, but we can think about it as, are they comfortable? Do they have privacy, security, autonomy, overall satisfaction with life, and their perceptions of health, especially after they have a medical diagnosis or a medical intervention? The goal of quality of life is to have a positive effect on an individual and their feeling of self-worth. Justice in the U.S. healthcare system is shifting more towards social justice, and that started in 1965 with the beginning of Medicare and Medicaid. Healthy People initiatives are 10-year plans. So we have Healthy People 2020, Healthy People 2030, etc. It identifies key national health objectives. It is founded on the integration of medical care, prevention, health promotion, and education. 3 goals of collaboration, empowerment, and measurement. In Healthy People 2020, the goals are of attaining high quality, longer lives free of preventable disease, injury, and premature death, and achieving health equity, eliminating disparities, and improving the health of all groups. This is so nursing. All of this is so nursing, but they're not calling it out as nursing. Creating social and physical environments that promote good health for all. Promotion of quality of life, healthy development, and health behaviors across all life stages. Healthy People 2030, the overarching goals are attaining healthy, thriving lives and well-being, free of preventable disease, disability, injury, and premature death. Eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being of all. Create social, physical, and economic environments that promote attaining the full potential for health and well-being for all. Promote healthy development, healthy behaviors, and well-being across life stages. If I can get myself out of the way. And engage leadership, key constituents, and the public across multiple sectors to take action and design policies that improve the health and well-being to all. The United Nations in 2016 adopted 17 Sustainable Development Goals addressing social, economic, and environmental determinants of health, and 169 associated targets focusing on 5 themes: people, planet, peace, prosperity, and partnership. And one of the students that I had in a previous program does work with the United Nations, which is super cool. So there's so many leadership opportunities in healthcare and nursing, so the world is your oyster. Public health, focusing on improving population health and well-being, focus on determinants to improve the nation's health and resolve disparities among vulnerable populations. So it's a framework embodying the social and medical determinants. I really like this infographic on healthcare delivery, looking at the social determinants of health. I know that you've talked about this in many of your classes. Hopefully you're continuing to talk about it in your clinicals, and I know that many of you have identified as this competency as an area you'd like to improve over the semester, of looking at the social determinants of health, whether that is recognizing what those determinants are or engaging in more conversations with patients and the interprofessional team to help patients all achieve health. We know that social determinants of health has a framework which includes demographics, personal behaviors, community level inequities, and their defining influence on health. We look at personal demographics like race or ethnicity or age directly contributing to vulnerability levels. And social and income inequalities have been shown to contribute to disparities in health, as we know. Looking at our community-based interventions, there's many community partnerships And we want to reflect on those priorities for the local populations, look at the management, the members of the community. We want to look at how we can minimize cultural barriers and improve community buy-in into this program. We want to look at how we can mobilize resources at the local level to address problems. So in conclusion, the healthcare delivery system of the United States, which you are leaders of, is driven by the medical model, which emphasizes illness rather than wellness. Holistic concepts of healthcare and nursing concepts, especially the Marquette nursing concepts, along with preventative and health promotional efforts, need to be adopted to significantly improve the health of all Americans. Hope this helps you understand the many challenges that the United States healthcare system has in place and how you can, as a nursing leader, make an impact on the health of all United States citizens. Thanks.